Hi, my name is Queena,
I'm Martin.
I'm Stephanie.
And I'm Katsy.
and today we're presenting on machine learning-based predictive modeling of COVID-19 vaccination uptake within U.S. counties. We're all students from the University of British Columbia, and we come from diverse backgrounds, ranging from kinesiology to engineering. But one thing that we all have in common is that we're all passionate about public health and technology. So that's why we're here today to solve a public health problem with the big data challenge this year.
The COVID-19 pandemic has left an unprecedented impact globally. Countries such as the United States have reported one of the greatest incidence of cases worldwide. Within the United States, the existence of various sociodemographic factors has contributed to the development of regional healthcare disparities, and the presence of these healthcare disparities has resulted in the unequal spread of disease and distribution of vaccines between counties. But why is that? As it is well established in the literature, sociodemographic factors can impact healthcare accessibility and thereby influence health outcomes.
As we found no other studies exploring the relationships between sociodemographic factors and vaccine uptake using the XGBoost algorithm, the objective of this study was to use sociodemographic factors that have been found in previous literature to be associated with vaccine uptake and use machine learning approaches to develop a model that can predict vaccine uptake. This is important because vaccine uptake is a crucial part of public health measures that will help bring communities back together. By using predictive modeling to understand the relationships between sociodemographic factors and vaccine uptake, we can better design vaccination campaigns for groups who may be more hesitant to receive vaccines and increase access to vaccines for populations who may face barriers to receiving them. In this project, we sourced 83 sociodemographic factors that could potentially impact vaccine uptake, and we organized them into 20 categories. Some of these categories include education, income, and employment levels. The data was collected from 5 U.S. databases as shown on our slide, and our study included 2,862 U.S. counties with data collected between 2015 and 2021. The percent of adults fully vaccinated against COVID-19 per county used in our project is representative of data from May 21st, 2021.
To create the model, the decision tree-based machine learning model XGBoost was chosen due to 3 major reasons. Firstly, it minimizes overfitting and improves performance compared to other traditional machine learning methods as it uses a more regularized model formalization. As well, it allows for a better real-world representation of how the socio-demographic factors we source lead to personal decisions to take the vaccine. Lastly, XGBoost is a method that allows interpretation of what the key socio-demographic factors are that drive the model's prediction in vaccination uptake percentage. As well, to create the highest accuracy model using XGBoost, we use custom hypertuned parameters for the XGBoost function that are found using grid search CV's function for computational fit. The parameters fitted are learning rate, max depth, min child weight, subsample, call sample by tree, and N estimators. Our model was able to predict vaccination uptake using XGBoost regressor function to produce a prediction accuracy score of 59%. As well, based on the data from the model, we were also able to produce choropleths of the U.S. counties to visually demonstrate areas with low and high predicted vaccination uptake. Something to mention is that purely white areas represent areas with no vaccination uptake data or other missing socio-demographic data. Moving on to our results, we will be further discussing the top 5 factors that drive vaccination uptake in U.S. counties. These include longitude, latitude, education, ethnicity, and median household income. So let's start off with longitude and latitude. Our machine learning model determined that longitude was the most critical factor in determining vaccination rates, and that latitude was the second most crucial factor. This suggests that geographic location plays a prominent role in vaccine uptake. We can see this is evidently true based on previous research studies, where individuals residing in the western U.S. were more likely to refuse their children's vaccinations. As well, a recent study found that COVID-19 vaccination coverage is much lower in rural counties. With this in mind, our results demonstrate that geographic location has a clearer role in driving vaccination uptake. However, the results do not specifically determine the direct relationship between how geographic location influences vaccine uptake. Therefore, future research could explore the specific implications of location and living in rural areas to determine where additional COVID-19 vaccination centers could be opened or vaccination campaigns could be targeted towards.
The next factor we are going to be talking about is education. While this study explored several educational factors related to education and educational enrollment, the factor with the highest feature importance was the percent of adults with a high school diploma only. Education was also the most highly represented categories of factors in our top list, with percent of adults with a high school diploma, less than a high school diploma, and some college or associate's degree all within the top 8 factors. Previous research indicated a relationship between vaccine uptake and education. In a previous study, individuals who had attained higher levels of education were more likely to accept vaccines as safe and vaccinate individuals in their care, such as their children. As our results do not determine the direct relationship between education and vaccine uptake, it cannot be concluded that level of education increases or decreases vaccine uptake. However, our results demonstrate that educational groups separated by secondary school attainment could be an important factor in determining whether an individual will receive the COVID-19 vaccine. Therefore, future research could explore the specific factor and how it impacts vaccine uptake.
The next sociodemographic factors that the model found to be important in vaccine decisions is ethnicity. Despite being twice as likely to die from COVID-19, there is consistent evidence that ethnic minority groups such as Black and Hispanics are less likely to be vaccinated for the disease compared to their white counterparts. It is well known among previous research that race and ethnicity play a role in some of the large differences that we see in vaccination rates, and therefore it is no surprise that some of the ethnicity factors we looked at appeared in the top spots of our factor rankings, specifically in 4th, 8th, and 13th place. Out of 6 ethnicity factors that we looked at, our model predicted that ethnic minorities, specifically natives and Hispanic, were the top 3 ethnic factors that would predict whether someone would go get vaccinated or not in U.S. counties. This finding provides evidence that it is extremely important special efforts are going towards centering marginalized populations in public health vaccination campaigns so that vaccine uptakes could be increased among those ethnic groups with historically low rates in the future.
Finally, we found that median household income was the 5th most useful factor for predicting COVID-19 vaccination uptake. According to other studies, household income is closely associated with socioeconomic status, and individuals belonging to higher socioeconomic status groups are more likely to receive vaccines. On the other hand, individuals from lower income households had less confidence in the importance of vaccines, while also being more vulnerable to the impact of the virus. While our finding is consistent with previous literature in that household income is an important factor that drives vaccine uptake, our analysis did not reveal whether lower or higher income households are more likely to receive the vaccine. Therefore, more research is needed to explore the relationship between these 2 factors. Moving forward, we hope our findings can serve as a model that other countries can utilize to predict vaccination uptake using their own unique set of sociodemographic factors. Although our study identified factors that are useful for predicting vaccination uptake rates, how and why each factor influenced the prediction rates were not explored. That being said, future research can investigate the mechanism by which each factor impacts an individual's likelihood to get vaccinated.
So the key takeaways from our presentation today is that first, we were able to identify the sociodemographic factors that are significant in driving vaccine uptake in U.S. counties. As well, we were able to pinpoint down and then rank the top 5 features that play the largest role. Secondly, we developed a tool that is able to predict 83 sociodemographic factors that will receive the COVID-19 vaccine in 2,862 U.S. counties with a 59% accuracy. Since we look at vaccination health behaviors, this can have a lot of applications and uses in not only the COVID-19 context, but in other diseases as well. Lastly, our findings provide support that the likelihood of individuals to receive a COVID-19 vaccination is, in fact, influenced by sociodemographic characteristics. In our data, we see that factors such as education and ethnicity were some of the top factors that predict COVID-19 vaccination. Education and ethnicity are examples of sociodemographic factors that have been found by previous literature to influence vaccine behaviors, and therefore, targeted efforts to increase vaccine uptake in such groups is evidently necessary. With a tool that can forecast which sociodemographic groups are more or less likely to get a vaccine in the future, public health officials have more time to prepare campaigns to help distribute or promote vaccine to those who need it the most.